we start talking about microbiome in sepsis. And the topic is very up to date because in this screenshot, you can visualize in the last 10 years how many papers have been published about this argument. And this is very important because we know that the alteration in microbiome is implicated in many diseases. And like a crosstalk between different organs. And you can have paper on cardiovascular disease, depression, in bowel, chronic inflammatory disease. So a very, very important topic. What is interesting to know is that microbiome is probably a part of a bigger puzzle in which we have the bacteria, we have the intestinal cell, and we have the immunity system below the intestinal cell. And is the interaction complex and functional between these elements that give us the gut barrier and the microbiome in its complex meaning. And what is interesting to note is that in critical patients, what we observe is the more the patient is becoming critical and the more the microbiome is changing. You can visualize in upper right side how the good bacteria, the commensal bacteria, are reducing and the bad bacteria are increasing when the patient is going worse. And this aspect is very important because, as we see before, the interaction between these elements exert an effect on the cellular, intestinal cellular, the gap junction falls, and bacteria or some products may enter in the body. And what is interesting to know is that this aspect is very, very complex. And when the bacteria enters in the body, they can move towards different organs, such as the liver. There is a very important paper now on gut-liver axis, or they can move to the lungs through the lymphatic way. And this is why often there is a very strict connection between the lung and the gut in the gut-lung axis. So it's very important to underline how the change in the microbiome will exert different and important effects on distant organs. The change in microbiome is called dysbiosis. And what is interesting to note is that many factors may provoke changing in the microbiome. The sex of the patient, the age, the nutrition, the stress, and the critical illness. But what is very interesting is that hospitalization is one of the main factors that disrupt the microbiome and let the patient be exposed to a following further sepsis episodes. And probably the most important factor implied in the disruption of the gut barrier is the administration of antibiotics. Different studies have shown how the type of the antibiotic, the doses, the number of the days, and the specific classes of antibiotics are probably the most important factor able to change microbiomes. And this is an example of changing in microbiome in critical ill patient. You can see in the upper left side the different sample of a patient admitted into an ICU and a sample performed at the discharge from the ICU. And what is interesting to note is that there is a very significant change in microbiome. And many factors are related, are guilty in provoking this change. not only antibiotics, that is probably the most important one, but also the inhibition of gastric secretion, the PPI, or the mechanical ventilation, or the administration of vasopressor that reduce the perfusion of the gut. So the interaction of this aspect probably is responsible for the changing in microbiome. And the changing let the bad bacteria grow up, and the bad bacteria and this growing up probably will damage further the barrier, and in a circle, in a vicious circle, it provoke the continuous effect of this situation. In this paper, that is one of the first many years ago, it was interesting because the changing in the microbiome, and the changing was measured as a inhibition of a particular bacteria, Tota obligati anaerobis, and increase of bad bacteria like gram-positive Staphylococcus and Enterococcus. And the change in this microbiome was guilty in provoking a more incidence of sepsis or bacteremia, and in changing the outcome of the patient. But it's not so easy, because the individual variability is very complex. You can visualize same disease, different patient, and what is the different microbiome of these patients. So the main difficulty we have in studying microbiome in septic patient is that we don't have a baseline, and that each patient may be different from the other one. You can visualize the change, the number of the patient, the disease is upper, and what the antibiotic administered during the recovery. And what interesting is that in all the patients, there is a reduction in the number of bacteria. There is probably the shift toward a particular negative or bad bacteria, but it's still too difficult at the moment to have a screen of the right changing in microbiome of the single patient. In COVID patient, we observe also a change in microbiomes. You can visualize the comparison between healthy volunteer and COVID patient. And what's interesting to note is that in COVID patient appear some bacteria that were not present in the healthy population. And the alteration, the disruption in the gut barrier probably is considered one of the factors that may explain the severity of COVID disease. There is some study that found a correlation between the alteration in the disruption in the gut barrier and the severity of the disease. The more the barrier is alterated, the more the COVID disease is present. And this is probably related to different mechanisms. Some authors think that the leakage of the barrier let the virus enter into the blood, into the lymph, and so the virus may be able to start a severe immunity response, or some authors think that the virus in the blood may move to different organs, and there create a replication of the virus and an organ damage. What is interesting to note is that the correlation is very important, because the immune system that is below the barrier is very, very important in controlling the body response to an infection, because often here have been released AGA immunoglobulin that move in the lung, move in other cycle of the body, and so it's very important this aspect. The correlation between the severity of the COVID disease and the alteration, the disruption in gut barrier is very important, because may explain why some patient have a bad outcome, may explain, because the disruption of the gut barrier persists even after the discharge from the hospital, and may be probably responsible for the chronic heal of this patient, and may offer us a new sort of intervention to treat this disease, the manipulation of the microbiome. What is interesting to know is that at the moment we don't have any fixed screen. We should start to consider microbiome like an organ, a functional organ, and so to start to measure the dysfunction of this organ, like we do for the lung or the kidney or the liver. But it's difficult because we don't have a uniform, a typical microbiome, because each individual has its own microbiome that is related to its age, what it eats, and what if it does, if it makes sport or not, or something like that. So there is a very high variability between people, and this is probably the most difficult point we have to overcome. What we should to do now is try to prevent the disruption of the microbiome. And to do that, we should use very antibiotic, very careful. We should try to avoid the inhibition of gastric secretion, and we should try to administer the vasoactive drug or other drugs only if really necessary. Thank you.